Hey, EO Alive TV, thank you for jumping in with us today. And I'm pleased to have Carrie with me today to give us an update on the COVID-19 situation. Thank you, Carrie, for joining us. And there's been a lot going on. People are anxious to get back to some kind of life that's normal, and the governor is kind of given us some guidance to help us with that. Not just the governor, but clearly there's a lot of people behind her that are studying this and so on and so forth. So why don't you catch us up? Tell us what is the newest thing, and then also bring that down to home. Where is Union County in that process?
Yeah, great. Thank you so much for having me here again this week. It's always great to have an opportunity to talk with you and the residents of Union County. Lots happened in the last week. I think it was one of my colleagues said to me earlier today, that was just last Friday that the governor held a press conference. It seems like the situation continues to be rapidly changing and rapidly evolving. And so I know what is probably on everyone's mind this week is when we are going to get to reopen and when we're going to get to move on to the next phase so we can start getting back to normal, so to speak, whatever our new normal may look a little bit different, but I think everybody's eager to find out and start going in that direction. So the governor did share last week the details for what kind of plans and information the counties needed to submit to the state to help them move into phase one. And so, as I'm sure most of your viewers are aware, Union County has written and submitted a reopening plan that is currently being considered by the governor's office. And I don't have any knowledge of when that information about who will move into phase one or what kind of response there are to any of those plans will come down, but we're hoping soon because the governor did share that things could reopen as soon as May 15th, which is rapidly approaching. So the idea is that there is a basic set of criteria that has been talked about by our governor that we would need to have in place to be able to reopen. And the focus is on, the number of cases that are occurring in a county, downward trends in cases and hospitalizations, and then having the capacity to do the testing, contact tracing, case investigation, case management, all of the things that you will need to have in place as a county to be able to handle a potential resurgence of cases that we could expect to happen as people start resuming public life. And so we're getting ready for that. I think that the plans are available. The Union County plan is available on the county's website. So I know that people can view that there and get information about what we proposed. I know that we're confident that we meet the criteria that the governor has set forward. We have no reason to believe that we wouldn't be able to enter into phase one. Again, we're still awaiting that decision, and that, hopefully will be forthcoming soon, and we'll be able to start taking those steps.
So, thank you. So, one of the things that I, have begun to understand is that we're going to be able to reopen, and then the amount of cases, if the cases increase, then those restrictions might come back. I guess the question I have is, how would they not increase? I'm not understanding. I'm just not understanding the math there. Because, you and I have talked about a little bit how the goal was to flatten the curve, and the evidence seems to suggest that our self-quarantining and isolation has helped that. But at some point we're going to experience, it seems like we're going to experience some more cases. And what is the tipping point on the governor's plan to where, okay, if you experience too many cases, then the restrictions come back? Can you kind of help us understand that a little bit?
Yeah, so I think that you are absolutely right. I think that there's no way we would expect that cases wouldn't increase. Right now we've been asking people to stay at home, limit their contact with other people, and now we're going to slowly start reopening some sectors of our economy, like restaurants. People will be able to go dine in. People will be able to resume shopping at retail establishments. There will be, things that are basically allowing us to interact more with other people. So the likelihood that the disease will transmit more is high. And so I think that, sorry, I kind of lost my train of thought there for a minute.
It's all right.
Sorry, I apologize. Every once in a while, sorry, the criteria, the threshold. So yes, so thank you so much. We, in our plan that Union County submitted, we did develop a set of criteria that we thought made sense in our community for what would be the points in time where we would reevaluate whether or not we needed to maybe step back some of the restrictions that we had lifted, maybe hold where we're at this, maybe we go into phase 1 and we hit a certain number and we decide, yeah, maybe it's time for us to hold right here because the number of cases are increasing. So, we did incorporate some of those in our plan that was submitted, Union County's plan, but I don't know that we're clear on whether or not those will be the criteria that are used or whether or not the state will develop criteria. So again, I think that some of the information about how we will know whether or not we get to continue to go forward or whether or not we'll need to hold or whether or not we'll need to pare back or, re-implement some of our restrictions that we have right now. I don't know that we're clear on what those criteria will be. Like I said, we certainly proposed some that we thought were reasonable for our community, but we're not sure exactly yet how that's going to roll out. I think that there's the way that I've been thinking about this is that, right now we have these social restrictions in place to limit the spread of the disease. So right now we've asked everybody to stay home. We've asked everybody to limit their activities in public. We've asked everybody to try and, physically distance, all the things that, we've been talking about over the last few months. And what'll happen in phase 1 is we're going to slowly start to reopen some of those facets of our life that I mentioned before. And the way that we're going to try and manage and restrict the disease will shift to the contact tracing, case investigation, that will result in isolation and quarantine of more people in our community that are at risk for contracting the disease. So, our case investigations will more likely include a broader spectrum of people, like the depth of the investigation will be greater. And then also the number of people that are in contact with a confirmed case of the disease that are asked to isolate or quarantine. Isolate would be somebody who has an exposure. Quarantine would be somebody who could have been exposed to somebody that may not have the disease. So again, I think the way I see it is that our strategy for how we keep the numbers low and how we flatten the curve as we move into these new phases is just a little bit different. It's a different approach and a different tactic. But I do think that we'll have an increase in disease activity. And again, that the goal doesn't change in my mind. Like, we're still trying to make sure that the disease rate in our community doesn't overwhelm our healthcare system. It's just that the strategies that we're going to use maybe look a little bit different in phase 1.
Well, and that makes sense. That's a little bit more of a intelligent strategy as far as I'm concerned, because and let me just make sure that I can recap what it is you said. So rather than having broad isolation of folks, it's going to be more strategic based upon contact tracing. So then when there is an infection that occurs, then it will be controlled by contacting those folks that were in contact with that positive diseased person and asking them to isolate and quarantine themselves depending on their situation. So it's a little bit more of a strategic approach rather than just a broad, hey, everybody stay away from each other. Is that kind of make sense?
Yeah, you always do a great job of summarizing it. I think that makes exact sense. And, I think that initially, when this disease first showed up in our country, we were still learning about it. We were still learning about how people got it. We were still learning about how serious it was. We didn't know the period of time that people could get sick. There were all these unknowns. And so the best strategy that we had at the time to protect people was to do what we did, which is keep people away from each other while we take some time to learn about the disease and learn how to manage it. Now we have more information. We know that people are most at risk if they're in close contact with somebody that has the disease for 15 or more minutes. So when we identify somebody that has a positive test result, our first step will be to contact them, really work hard to identify any person that they had come into contact with that meets that criteria. And then we will contact all of those people. If they're sick, we'll ask them to do certain things. If they're asymptomatic, we're probably still going to be asking them to quarantine themselves. And I think this is where, our community can really play a part in making sure that we continue to move through the phases without overwhelming our healthcare system, without needing to step back and have the restrictions some of the restrictions we have in place now. Is that, if we do stay home when we're sick, we do stay home if we're a contact to a case, even if we don't maybe have signs of illness, because again, we think it's possible that you could have the disease and get other people sick, even if you're asymptomatic. And then again, following the guidance that the governor has put forward, which I haven't quite had a chance to talk about in great detail yet, but as we move into phase one, there's going to be a set of guidance documents that are going to help business owners, that are going to help employers, that are going to help members of our community kind of understand what mitigations they can put in place to make sure that we're keeping the disease transmission as low as possible. So the way that I see it is that I know everybody wants to get to the outcome of, getting back to normal, and we can all do something to help us get there. We can follow those recommendations as a community. We can stay home if, the contact investigator asks us to stay home. Those are all things that we can do to help support us as a community getting to that outcome.
Good. And there's a running conversation on Facebook about this. And, one of the comments that Marla makes is that we need to quarantine the sick, not the healthy, which is a kind of a generalization of what we're talking about. It's quarantining those people that have also been in contact with those that are sick to keep it from spreading. And it's kind of funny, interesting, almost entertaining how politicized this entire thing has become because people care about it. I mean, they're at the end of the day, and you and I have talked about this before, it's affecting their income. Business owners are, some of them have gone out of business because of it. So they care deeply about this and want to get back to some kind of normal life. So I'll tell you what, so let's shift to, and we're going to put these links in this post later, but let's shift to what are some of the sectors recommendations that the governor has made? Do you want to go over those a little bit with us?
Yeah, I can talk briefly about them. What I will say is that all of the information that I am going to talk about right now can be found on the governor's COVID-19 website. And right now, because we are getting ready to start allowing counties to move into phase one, hopefully as early as Friday, this website is being regularly updated with new information so people can be ready on Friday when she says they can move into phase one. So one of the things that's on this website is there is statewide guidance. So guidance that applies to the state immediately as of Friday, I believe. Again, this is new information, so it is changing rapidly. but there's guidance on face coverings. There's guidance on things that the public can do. And so as an example, if you look at that public guidance document, it will tell you the things that we have been telling you since day one, which is things like stay home if you're sick, try and stay away from people that are sick, practice good hand hygiene. I mean, we know that the disease can live on surfaces, and one of the ways you can get infected is touching that surface and then touching your face. And if you're going to go out in public more, you're more likely to come into contact with surfaces that somebody that's ill has touched. So, those really basic things that we've been asking people to do all along, basic things that prevent viral transmission, this is how we can help keep the disease rates low in our community. There's also guidance for outdoor recreation, employers, retail stores, and then specific to counties that enter phase one, guidance related to restaurants and bars, personal services, and malls, which I don't know if we have anything in Union County that classifies technically as a mall. But so you can see all of those documents and see not only what restaurants and bars or your personal services provider, the person that cuts your hair, are going to be asked to do to protect themselves and their employees as we move into phase one. So you can understand the role that you can play in helping them stay open. I mean, I think, Brent, I totally get that you've shared this with me. Like, I understand, I've talked about it before, how much of an impact this has had on the economy. I understand that businesses are struggling. And so again, I feel like we as community members can play a role in helping them stay open by helping them implement the guidance that helps keep the disease spread down, that helps protect them as workers, that, again, we can all play a part in this.
Yeah. And I have a friend who has a hair salon, and, she's preparing to jump through the hoops in order to reopen. And one of the things that she expressed was, a hair salon spa is a very hands-on thing. That's the whole point of people paying money to go to that kind of a service. And so, she's concerned about how to make that happen. How do I dote on my customers if I have a limited ability to even have contact with them? And so, so one of the ways that we can help as the customer is to overlook that, to continue to frequent that place, even though you might not feel like you have the service that you once did, hoping that, at some point we're going to be past this and it will be the service that they once received. So.
Yeah, and I think that, being understanding of the criteria that the state is putting into place for these business owners, again, the whole goal is that we want to protect the people that are working in those settings, and we want to make sure that the people that are going into their business aren't taking, or are having the lowest possible risk, right? And so as a business owner, I'm sure I can't imagine anybody wants somebody to come into their business and get sick. And as a customer, I don't want to put anybody at risk myself. So, being thoughtful, if you're sick, maybe you postpone your visit. You can still reschedule and support that business, but maybe not go, be thoughtful. If they ask you if you're sick, they're going to probably ask you if you're sick. And if you they're going to ask you not to come so they don't get sick. And, just really being a partner in supporting them, both in terms of patronizing them, but also supporting the mitigations that they're being asked to put into place, because those mitigations are based on our understanding of how viruses spread, and they're all in place to keep us all safe.
Good. And I appreciate all of that. And I think one of the things that I have wrestled with here, and part of it is because it's part of my job. When I produce video for a client and so on and so forth, they tell me what they're wanting, and I tell them what I can deliver. But part of what I'm also doing is managing their expectations. I'm not going to produce a Star Wars epic film for them for, $5,000. And so I have to help them understand, I help them have realistic expectations. And I think that, part of what we've missed in this scenario is the realistic, the expectations are a little bit out of whack, so we came into this thinking if we isolate this, if we go through this hard time, it'll go away. Well, that's not realistic. It's not going to go away. There is nothing to prevent it. There's nothing more to prevent it than what there was 2 or 3 months ago when we started this mess. We're still exactly at the same place where we are. We have more knowledge, we have more experience, we have more intelligence about the disease, but we still have the same tools to use it that we did before. And I think that people thinking that if we start opening up and at all levels, that the disease is not going to increase. Well, that's not a realistic expectation. But part of that is helping people mitigate risk, because we mitigate risk all the time. If you go skydiving, you mitigate risk. If you walk across the street and you're not at a crosswalk, you're taking a risk. And we do that all the time. And sometime in this thing, I think people get frustrated because their ability to mitigate their own risk has been taken away from them. And that makes them feel, injured. And so I guess that's part of my thing, is helping people understand realistically what they should expect. Have any comment on that?
Yeah, well, I think this really is all about risk. And then I also feel like for me, I balance that with my sense of duty to my community. I feel like part of this is about me. Part of this is about keeping me safe. Part of this is about me being able to make my own choices. But it's also for me about understanding that my choices do have an impact on other people. And so it's really trying to find a balance with that. And so, I feel like what I would like people to maybe try and think about is that, we may ask you to wear a mask, but, we're not sitting here saying like, yes, you have to wear a mask, like you have to do this. It's not about trying to make people do things that are uncomfortable for them or that they don't want to do. It's about us asking you to take a step that will keep people in the community safe, and that will keep the spread of the disease down, and that will keep us moving in the direction that we want to go, which is toward reopening, toward rebuilding our economy, toward, some of the recovery that I know people are anxious for. And so again, to me, like both of those things have to exist at the same time. And I shared last week that, I talked about thinking about my own risk and thinking about, the risk of my family members who maybe are in the higher risk groups. And, I still think every day, like, we have to make choices about what level of risk we're willing to take. And are there things that are worth taking the risk that we might get exposed ourselves, or that we might be exposing a family member? And then, just again, for me, I've also just modified some of my regular behaviors. Like if I go get my groceries, when I bring them in the house, I wash my hands afterwards really well for 20 seconds. I didn't realize before this how I was not probably washing my hands anywhere near 20 seconds. So, that's just a step I can take to minimize the chance that I'm bringing the disease into my home. And then when I go out again next time, taking it to my family members or my neighbor or my coworkers or a business owner in the community that I want to be able to stay open and succeed going forward. So again, for me, it's just that balance of like, my ability to exercise my own choices, make my own decisions for myself and my family, but then also considering how my behavior, my actions, the decisions that I make could have an impact on those outside of my home and in my community.
Well, and thank you. That is a really good point. And so what you're saying is, yes, you take a risk when you cross the street, but it's a different risk if you're pulling your kid along with you. And this disease function is, not only are we risk. Yeah, I mean, I thank you for that point. I get that, and that's a really nice clarification. So, well, let's talk for a minute about, and you and I talked off camera about this a little bit, about how and somebody on Facebook also mentioned this, that, the original goal was to flatten the curve. Now that we've flattened the curve, the conversation seems to have moved to preventing catching the disease altogether. And I think for the person not entrenched in this every day, that feels like the goalposts are being a little bit moved. It's kind of like the analogy that I've used is that it's like somebody saying, hey, don't walk on that path because it's close to the cliff and that path is icy and you might fall in, and now it's a bright sunny day, the path is dry, and they say, oh, don't walk on that don't walk on that path because it's close to the cliff. And so the messages have shifted a little bit. And I liked your perspective. Talk about how people might perceive that, but how that from your mind, the messaging is still really the same. Talk to us about that a little bit.
Yeah, I really appreciated you sharing this with me because for me, I don't see it as the message being any different. For me, when we initially started responding to COVID-19, we heard that phrase "flattening the curve" so many times. It was something that I never thought we'd be talking about, and we were talking about it many times a day, all the time. And I feel like, yes, we have flattened the curve. And I guess to me, I just see what we're going to do now as a continuation of that. But the goal is like, we got to keep the curve down. Like the idea of we put these physical distancing measures in place to make sure that that curve did not rapidly increase, that our cases did not overwhelm our healthcare system. Well, what we're going to do now is we're going to slowly start reopening things. We're going to slowly open our doors, and we're going to see if it shoots straight up, or we're going to see if whatever little gradual openings we do, it stays flat and we can still manage the disease. And then we're going to open things up a little bit more. And we're going to kind of keep going. It's like we're going to test the waters and we're going to see if we can handle it. And if it's okay, we're going to go in a little bit further. It's like we just have to take these small steps. So the objective in my mind hasn't changed. The goal is still for our system to be able to handle the rate of disease. And at the time that we put our initial social distancing in places, that was the best tool we had in our toolbox. So now we know that we can manage the curve, that we can keep the disease rate low, given the measures that we put in place. And so now we just start taking a few steps toward reopening and see if we can keep it low. See if it shoots straight up, or see if it can go in a slow, it's probably going to go up. No matter what, it's probably going to go up. The idea is that we don't want it to shoot up to the point where we can't care for people when they're ill. I don't see that as being a different objective than we had initially. Our strategies are different. The approaches that we're taking to keep the disease rate low are changing as we move into phase one, because that's, we can't keep everything closed for eternity. Like, that's just not realistic. We do have to go back to living. So now we've developed a different strategy: contact tracing, really identifying people that have a contact with a confirmed case, really managing their interactions with other people. And then at the same time, asking people in our community to still try and engage in the social distancing practices. I mean, there's still value in limiting our interactions with people outside of our household while we move into this phase. I think anything we can do to limit our interactions, limit our contact within reason, right? As we move into the next phase, will again keep that disease rate low. So I just don't feel like the objective is any different.
Thank you. I can see that, and I appreciate that explanation. And it will be interesting to see how people adapt and respond. I help my church stream their Sunday morning services, and there's just a very small crew that makes that happen every day. every Sunday. And it was funny to watch people. They were hungry to interact with folks. I mean, we probably have more communication in our lives right now than what we've ever had, but a lot of it is not face to face, and anyhow, we joked about, well, how are you going to know once it's okay, even a month from now, I don't know, whenever that might be, how are you going to know whether somebody is comfortable with bumping elbows or shaking hands or, whatever it might be. And, we joked about, well, we'll have to have different colors of bracelets, and so then the huggers will have a blue bracelet, and anyhow, it's just kind of an interesting thing. Nobody ever imagined that we would be where we are. So,
Absolutely.
wow. Yeah. Well, hey, thank you so much. I'm trying to think, is there anything pertinent that we need to touch on before we quit, Carrie?
No, I think that I just want to make sure that people in our community do know about those resources that are available on the governor's website that we will surely be promoting as we learn more over the next few days. I'm sure we'll get a lot more information about what's to come next week. But those guidance documents are going to be really invaluable tools for people in our community, again, to help us open and help us stay open. I mean, I think, again, the objective in all of the things that we are going to be asking the community to do in terms of mitigations that they put in place in the workplace, or, if they're identified as a contact in an investigation, the steps we're going to be asking them to take, all of those things are to help us stay open once we reopen. So we'll look forward to sharing information with the community about how they can play a really vital part in that.
Good. And just for some of the people on Facebook, your concern is taking care of, and let me just say this to them, CHD and Carrie's concern is, it's not some allegiance with Governor Brown. It's not some agenda. Your care and concern is for the people of Eastern Oregon and how this disease might affect them. And I mean, I'm sure that you guys are taking some heat about that every once in a while. And I just want to thank you. I know that, you're kind of having your job is probably one of those things where when they want you, they're really happy to see you, when you're maybe talking about things that inconvenience their lives, that you're just the messenger, you're just passing on from someone else, then you kind of get the shoot the messenger thing every once in a while. And I just want to tell you that thank you for what you're doing. Yeah.
Thank you. I really appreciate that. And yeah, I mean, obviously we're, our goal is to save lives. And I know that it may be hard for people to feel like it's a serious issue here, given the fact that we've been super fortunate in having a relatively low disease activity in Union County. But, we have seen other communities just over the mountain. Umatilla County has had 2 residents pass away due to COVID-19. They've had a large spread of disease. So obviously, as a public health department and working in public health, that is our primary objective. But I do hope that people see that part of our encouraging people to limit the spread of disease does support and promote all of the other objectives that are important to people, like businesses, and that, all of the things that we're going to be asking people to do moving forward are really helping support those goals. And so hopefully we can all work together and quickly get back to the normal that we all want so badly.
All right. Well, hey, thank you, Carrie, for coming on, and we will see you again next Wednesday, hopefully with more opening information. Yeah. And thank you, EO Alive TV, for tuning in, and we will see you next time.